low thyroid hormone will interfere with the release of the egg from the ovary. So it will impair fertility because it impairs ovulation. So the underlying cause of hypothyroidism is often autoimmune, and autoimmune conditions also impair fertility as well. So what triggers Hashimoto's is similar to what can affect infertility.
Welcome to Get Pregnant Naturally, where functional medicine and natural fertility solutions will help you get pregnant and have your baby. Hey everyone, I'm Sarah Clark, and my mission is to inspire, motivate, and empower you. Most of all, I want you to wake up. So with functional medicine, we can discover what causes infertility and eventually reverse the condition. Today, I'm welcoming Dr. Anh Nyugen to the podcast, and we're digging into the connection between Hashimoto's and fertility. Dr. Anh Nyugen is a licensed pharmacist and a functional medicine practitioner specializing in Hashimoto's and thyroid conditions. She is host of the popular Food as Medicine with Dr. Anh podcast, where she interviews people and practitioners who have healed themselves or others from chronic conditions using simple changes in their food, supplements, and lifestyle. Check out her website at dranh, so DRANH.com. Before we jump into today's show, don't forget to hit the subscribe button on iTunes or wherever you're listening to this to make sure you never miss an episode. Hey, Dr. Anh, excited to have you on the show.
Thanks, Sarah. I'm so happy and honored to be on your show. I'm excited to talk to your people.
Awesome. Yeah. So if you could share your journey and really how you came to do this work.
Yeah, so my background is I'm a licensed pharmacist, and I also am a functional medicine practitioner. And I kind of fell into functional medicine, but also because I was looking for something different. I mean, after working as a pharmacist for 1 year, I realized that I'm not actually helping people. Giving them medications, I would see patients come back month after month, and instead of seeing them get better, I saw them get progressively worse. And I was adding more medications every month. And there was one patient specifically, I remember he had literally 20 medications in his basket, and I would make sure I counted to make sure I wasn't missing anything. And I sat down and I thought to myself, wow, he's on 4 inhalers, and he's on pain medications and constipation medications because of his pain medications, and then a whole list of other things. And he was one of my favorite patients. And, he'd come in with his walker and, shuffle, and then he'd have to sit down for a little bit because he got really tired, and then, get back up and shuffle and sit down. And eventually he stopped coming into the pharmacy because he lost his mobility. And then one day, so then we would need to deliver his medications. And I said, okay, if I can sit down and help him, quit smoking and eat better and start moving a little bit, I know I can help him reduce some of his medications and improve his quality of life. And that was kind of a big aha moment for me. And then I eventually I read a book about the elimination diet. I did the elimination diet. I found I was gluten sensitive. And I was like, wow, there's this big world of, food sensitivities and functional medicine that I didn't know about. So I was just like, okay, I got to explore this a little further. And I went down that rabbit hole of learning about functional medicine. And I realized this is what's actually going to help people heal. This is what I've been looking for. And basically I quit my job as a pharmacist, and I said, I'm going to be a functional medicine pharmacist. And I had my podcast that I launched, and luckily I had Isabella Wentz on my show, and then she kind of took me under her wing and taught me everything I know about Hashimoto's. And for the past 3 years, I've been deep in the world of Hashimoto's, and now I've kind of gone on my own, and now I help people who have Hashimoto's and heal themselves, get rid of their symptoms and improve their lab, and basically get their thyroid working again and feel like they have their life back. So that's how I kind of got into it.
Amazing. And did you have any thyroid issues yourself, or what about the Hashimoto's kind of resonated with you?
Yeah, so I have always been cold intolerant. My friends made fun of me. I think I have snowman pox is what they called it. So anytime I got cold, I would get hives all over my body. And it would be the middle of summer, but I would walk into a room and it would be air conditioned, and I'd break out in hives. And so that was one thing. And then my eyebrows, ever since I was a teenager, were really thin, and they never grew out. And then in college, my hair started thinning, and I've always had a little bit of a weight problem. So all of these were clues. And whenever I got my, thyroid tested, it was always normal, according to my doctor. But now that I know more, I know that symptomatically I have thyroid symptoms, and even though my lab numbers don't show it. And so I'm still kind of working through healing myself, putting myself on my own protocols. So I have a subclinical hypothyroidism.
Okay.
Yeah.
Okay. Yeah. I have hypothyroidism as well. And it was sort of the same thing with the hair falling out and the eyebrows. And it's like, wait a minute, everything's looking normal. And it's not.
Nope.
Yeah. And it is a journey, right? It's not just like this magic, health right away, but you each day you do a little better and make tweaks and changes and not pushing yourself to do the 100 million things that you think you can.
Yeah, I definitely did that in college. I was burning the candle on both ends, and I really felt it after I graduated. And, I would have trouble remembering words. And even today, like even now, I still have a little bit of brain fog. Like I'll forget things. And so I'm kind of slowly learning to take care of myself and working on my adrenals. And for go-getters like us, that's really the hardest part, is just like slowing down and making that time for self-care. But it's important.
Mm-hmm. Yeah, so many women that come to us are that type A woman that's really researching, and you've got a plan and making things happen, and then now they're struggling with their fertility. So let's kind of dig into how why thyroid health would be important for fertility.
Yeah, so there's definitely a link between hypothyroidism and infertility. So there's many reasons why someone might be infertile. One of those reasons might be that they have suboptimal thyroid function, and it could be that missing link for some people why they've been diagnosed with infertility, but it's like unexplained.
Right.
So similar to my case, it would be a subclinical thyroid problem, which means, maybe they have a history of thyroid disease in their family, and, they've had previous miscarriages. Maybe the woman has irregular menstrual cycles and they've tried to conceive for 6 months or more and they haven't been able to succeed. So all of those might be clues to look at your thyroid. And, low thyroid hormone will interfere with the release of the egg from the ovary. So it will impair fertility because it impairs ovulation. So the underlying cause of hypothyroidism is often autoimmune, and autoimmune conditions also impair fertility as well. So what triggers Hashimoto's is similar to what can affect infertility. And it's really important that is looked at as a potential cause for fertility in people. And even after the hypothyroidism has been corrected and you see that a person is infertile, then there might be other things that need to be looked at, which then you would be the expert in handling. So, if someone hopes to get pregnant and you haven't been successful, make sure you check your thyroid. And when you become pregnant and you have a thyroid problem, you need to monitor your thyroid hormone levels, because abnormal thyroid levels can affect the development of the fetus and then also increase the risk of miscarriage if your numbers are out of range. So there's definitely a link between hypothyroidism and infertility. So it's important to kind of think about that if you're having trouble conceiving.
Mm-hmm, absolutely. And I guess, so a lot of people have been told their TSH is normal. And so why is this not a reliable marker for your thyroid health?
Yeah, so conventional medicine uses TSH as a way to diagnose hypothyroidism. And so what TSH is, it's a pituitary hormone. So what that means is your brain releases this hormone when it senses that there's not enough hormone in your body. It's like the CEO or the manager telling the worker to work harder. But oftentimes, the problem already existed for a while before it's been noticed. So maybe the worker's been kind of lazy, hanging out on Facebook, and finally, the productivity has decreased enough that the manager noticed. So similarly, a person can have symptoms of hypothyroidism long before the TSH is elevated. And so, it's a way to diagnose hypothyroidism, but it can be very misleading. And oftentimes, as we get older, the TSH can increase as well. So that can be a convoluting factor in that as well. So people who have elevated TSH, like the doctor could just dismiss it as, oh, you're getting older. But no, maybe you're not getting older. Your thyroid's not working. So it's one thing we can look at, but what's more important to look at is the free thyroid hormones and seeing where that is at, because that's what active hormone is available in your body to be used. So looking at that is more indicative of what's going on versus, the TSH, which gives a broader view and is only elevated in most cases in the later stages of thyroid dysfunction.
Yeah, so looking at the full panel, because I think a lot of times people are just getting the TSH and it's flagged as normal. Maybe it's 3 or even 2.5, or it can be 5. It could still be normal.
Yeah, and the people that we work with, what I found is typically like a 1 to 2, like a really small window. The TSH between 1 and 2 is where most people feel their best, and everyone is a little bit different. Sometimes some people need to be on the lower range of that, and some people can be outside of 2 and feel good, but most people like kind of fit in that range. And some labs will accept up to 4.5, a TSH of 4.5 as quote unquote normal, and people will feel like crap, and their doctor's like, they just dismiss the symptoms as, oh, you're still in range, it's okay, and it's not.
Yeah, that was me for a year. I had basically, my hair was falling down the drain every day, and I'm like, oh, your thyroid's normal. Even my hairdresser is like, have you looked at your thyroid? I'm like, it's normal.
Right.
Oh yeah. Yeah, and as far as conventional doctors, as far as the autoimmunity side of things with elevated thyroid antibodies, what's your take on that?
Yeah, so some doctors might not diagnose autoimmunity based on elevated thyroid antibodies. And it's a little complicated in the sense that, just because you have elevated antibodies, so, okay, let me backtrack. So people with Graves' disease, people with thyroid cancer, people, even normal individuals, if you do a blood test on them, they can show elevated thyroid antibodies. And so, then that can mean if someone's normal, they can have elevated thyroid antibodies. That means that there's an immune attack on the thyroid gland, and that's why you have the antibodies. And the higher the number, then the greater the attack. So most conventional doctors, they will not test antibodies unless the TSH is elevated. And we just talked about how TSH typically isn't elevated until you have an advanced disease, or sometimes it can be like low or high or even normal. It can fluctuate because stress affects it, temperature affects TSH. So there's many things that can affect it. So the problem is you can have elevated antibodies for years before you see a change in the TSH. And so during that time, your immune system is attacking your thyroid gland and you're feeling all these symptoms. So conventional thinking is, okay, so if someone has thyroid antibodies, but their TSH is normal, then the patient's probably fine. Like they're probably not experiencing symptoms. And even if they are experiencing symptoms, the doctor typically just dismisses it as it's not real, so, and they feel like there's nothing that they can do for these people. But we know now that that's not the case. And so the other thing that kind of plays into it is people who have Hashimoto's, 80 to 90% of them will have elevated TPO antibodies. However, the University of Wisconsin researchers studied people who had Hashimoto's, and what they did was they took a biopsy of their thyroid and they looked at it under a microscope. And they found that only about half of those people actually had elevated thyroid antibodies in their thyroid tissue. So even though they were diagnosed with Hashimoto's through like an ultrasound or other method, not by blood test, they didn't find antibodies in the thyroid. So what does that mean? So then that means that, you can have Hashimoto's even if your thyroid antibody test is negative. And new research shows that between 10 to 50%, so even up to half of the people who have Hashimoto's might not test positively for antibodies. So that case is called antibody negative or seronegative Hashimoto's. So then now we have this thing where, okay, most people who have Hashimoto's will have elevated antibodies. However, that's not always the case. And so what does that mean? That means you can test thyroid antibodies, and if they're positive, then you likely have Hashimoto's. But if they're negative, that doesn't mean you don't have Hashimoto's. And Dr. Alan Christensen is like a world-renowned thyroid expert, and he talks about with thyroid biopsy, that's mostly done in people with thyroid cancer, but that's one of the ways to definitively tell if you have Hashimoto's. But he still says that even like if you take a biopsy and you look at the cells under the microscope and you don't see Hashimoto's, that doesn't mean that you don't have it. Because unless you look at every single cell in the thyroid gland under the microscope, you cannot rule out that the person does not have Hashimoto's. So it's kind of complicated. So I can see why, a doctor who like normally just looks at the TSH and it's not elevated, so it's fine. So it's like, why do I even bother looking at the thyroid antibodies? Because sometimes it's not elevated in people with Hashimoto's. So it's like a lot of factors at play. But at the end of the day, what's most important is, we have been trained to look at the person, not the number. Like that's been drilled to us in school, but in practice, that doesn't always happen. So it's important that you find a practitioner who actually listens to what your symptoms are and doesn't just look at you and say, oh, your labs are in range and so you should be fine. Like, you have to look at the labs, you have to look at the ultrasound and all those other tests, but also take the person's symptoms in consideration. And both of those things will paint the bigger picture of what's going on.
Yeah. So then going for a biopsy, is that even recommended? So why would we want to put ourselves through that if it could be a false
Yeah,
negative?
so it's super invasive, and doctors reserve it for kind of thyroid cancer cases. So it's typically not normally recommended. So if you have negative thyroid antibodies on a blood test, one thing you can do is ask for a thyroid ultrasound. And on the ultrasound, you might be able to see nodules or changes in the thyroid tissue, which would be indicative of Hashimoto's or development of hypothyroidism. So that's one way, and it's a less invasive way to diagnose as well. So yeah, so if you can do the blood test or the ultrasound, and then worst case scenario you can do the biopsy. But clinically, if you have symptoms and your labs look normal, I would still say go with the interventions, because interventions are safe. Removing food triggers, helping reduce your toxin exposure, getting your adrenals to work better, healing your gut. All of those are kind of common sense foundational things that wouldn't hurt and would heal in a suspected thyroid case, even if your numbers look normal. Does that make sense?
Yeah, that's when we dig into the food sensitivities, the hormone testing using Dutch, and then look at the DNA of the stool for potential gut infections, which we'll get into later. And and what kind of symptoms? Obviously, we think of the hair and the thinning of the eyebrows, dry skin. Like, what are the other symptoms of thyroid issues?
Yeah, a lot of people have
a host of them, I guess.
And because thyroid hormone is utilized by every single tissue in our body, it can affect every single organ system and every single, body system. So that could show up as rashes, migraines, anxiety, depression, fatigue. It can show up as joint pain. So it's just a whole host of things. And it could be thyroid, it could be autoimmune. So it's sometimes hard to tease out, but I'm sure you would agree, like, the way you approach people who have infertility is similar to how I would approach someone with Hashimoto's. It's kind of the basics, So the treatment is very similar, even if the target is different, if that makes sense.
Exactly.
Yeah.
Okay, and so then a lot of people that are on thyroid medications, such as Synthroid, or I'm not going to pronounce this one,
Levothyroxine.
So what's your take on those?
Yeah, conventional medicine says if you are diagnosed with hypothyroidism or Hashimoto's, then that means your body is not making thyroid hormone. So what do? You give it the hormone that it's not making. And so levothyroxine or Synthroid is T4. It's one of the hormones. However, T4 needs to be converted to T3 because T3 is the active form that is usable by your body. And Synthroid can work for some people, but if you have a problem converting T4 to T3, that happens in the liver. So if you have a sluggish liver, it's been backlogged with like a toxin overload, then you're going to have trouble converting. If you have low selenium, which is, a nutrient that's needed in the conversion of T4 to T3, low zinc, all of those nutrient deficiencies can play a factor as well. So if you're only taking T4 and you're depending on your body to convert it to T3, that might be inefficient because your body's just not working optimally. So some people can do okay on T4, other people, and this is what we find is most people need a combination of T4 and T3 to feel better. So that would be like T3 would be like a cytomel. And first you can start off on the Synthroid, and then we can add cytomel to see how you're feeling. And then once we get the right ratio, then that would be your dose. And then, some people prefer, or maybe they have problems with some of the fillers in the medication. Some of the medications have lactose. Some of them have, just inactive ingredients, supposedly inactive ingredients. There's some that have like gluten cross sensitivity. Then we just kind of dig deeper. If your medications still aren't helping you feel better, then we can look into natural desiccated thyroid, or we can look into compounded medications. So there's different options, but typically just Synthroid alone for most people won't cut it.
And can you spell the last one? You just said it was Synthroid, and then the other one was for the T4. Sorry, I missed the.
So T4, so levothyroxine,
Or so the
and
other one
then
you mentioned was
natural desiccated thyroid, and compounded medications.
no, you mentioned if we're doing a Synthroid and that's not working for T3, and then you add in the
Oh,
T4, and then it was
cytomel,
yeah. How do you spell that?
Cytomel.
Oh, perfect. Okay, Cytomel. Yeah, because a lot of these can have the fillers, the food allergens, so lactose, gluten, and we'll talk about that a little bit later too, I think, but gluten not being recommended for thyroid. So then if you're taking a medication that potentially has some is produced in a facility that is exposed to gluten, what's your take on that?
Yeah, so tyrosint would be a good option for some people. It's like a hypoallergenic synthetic thyroid hormone. So if people have some cross-reactivity to gluten, or if they have lactose sensitivity, that might be a good option, or natural desiccated thyroid or compounded medications.
And how do you spell how do you spell tyrosint?
Yeah, Tirosint.
Okay, I was close. Just put the Y in there. Okay. And then as far as the natural desiccated thyroid, so a lot of people will go to their doctor and say, hey, can I have this? And the doctor will not prescribe it. So what's your take on that?
Yeah, so natural desiccated thyroid, or NDT, has had a bad reputation because in the past, some manufacturers have had discrepancies between batches and kind of unreliable dosages because they used to measure the medications by the amount of iodine in them, and really they should be measuring the amount of hormone in them, because that's what we're replacing, is the T3 and T4 hormone. So once that was standardized, it became less of an issue. However, so RLC Labs, they make WP Thyroid and Nature Thyroid. Those are two brands of NDT, and they have never had any of their product recalled for dosage inconsistencies. So just because like one brand has had that happen, like then the whole category of NDT has gotten a bad reputation. So then that leaves like a sour taste in doctor's mouth. And so that, now understandably, they're a little hesitant to prescribe it. And recently there's been issues with sourcing products, like raw material to manufacture. So the manufacturers of WP Thyroid and Nature Thyroid specifically, the ones who've never had issues with dosage consistency, like they now have issues with raw materials, like they can't get their raw materials to make it. So then, people who need medication, like they're waiting for back-ordered medication for months. So that's just another issue. So that's why some doctors just might not be like jumping at the gun to prescribe. And then some of them just aren't comfortable dosing with these medications because, first line of therapy, according to drug guidelines, is Synthroid. So because they haven't had experience with NDT, like they just feel uncomfortable prescribing it. And so my recommendation is like you really want to work with a doctor who is comfortable with dosing and using these medications, because then they'll be familiar with, how you would react and how you would tolerate and how to dose adjust. And so thyroidpharmacist.com I really like that resource, because then they have a clinician database. So you can look and find clinicians in your area that are more open to these natural alternative approaches. So they would be more open to prescribing NDT. The only other thing I would kind of caution, because sometimes people think, oh, NDT is more natural, that's what I want to go for. NDT does work for some people, but also keep in mind, because it's like desiccated thyroid of a pig, then it's natural thyroid. And because it's natural, it will have TPO, like thyroglobulin in it, which means it can worsen the autoimmune attack in some people. So while some people can tolerate NDT very well, others cannot. So that's just another consideration as well. And if you can't tolerate, then compounded medications would be a good option.
And so how would you know that so obviously if you switched over to a desiccated thyroid and you would then feel worse, or how would you?
Yeah, you would feel worse, and then you would measure the thyroid antibodies and see if they're elevated.
And then Armour used to be the go-to kind of natural desiccated, and then something happened with that recently.
Yeah, well, so I can't remember. I think that was also like a manufacturing issue. But as far as I know, like they're back in stock. But I know people who are on like WP, because WP is hypoallergenic as well. So that one people are having trouble getting access to.
So if there is a thyroid issue going off thyroid medication altogether, What's your take on that?
Yeah, so hormones are funny. Like you shouldn't quit them cold turkey because then you'll have negative effects. I guess some people just kind of get tired of taking medication, so they just kind of quit. But most people won't feel good when they do that. So if you're gonna change or stop, then I recommend kind of a tapering approach where you kind of slowly decrease the dose over time, so your body acclimates to the change easier. And especially if you're making, dietary changes, you're adding the nutrients that your body needs, you're healing your adrenals and your gut, your dosage needs will decrease. And so you do need to monitor and decrease, because sometimes like as your thyroid starts to make its own hormone and you're taking thyroid medication, you might actually feel worse because you're getting better. Mm-hmm. So that's when like we know we need to start like decreasing your medication.
So monitoring every couple months then, or what's the suggestion?
Yeah, so every 4 to 6 weeks is if you're making any sort of changes. It's always good to check your thyroid labs, TSH, free T3, and free T4 at minimum. Otherwise, thyroid antibodies, so anti-TPO and anti-thyroid globulin. And in some people, if, we suspect maybe infections or adrenal things, then we can test reverse T3 as well.
Mm-hmm. Okay, and that website, so thyroidpharmacist.com, check for a practitioner in your area that specializes in this. Okay. And then as far as medications that include fluoride, which is not recommended for thyroid, what's your take on that?
Yeah, so there are common medications that people take for anxiety, for like acid suppressing, some antibiotics, cholesterol lowering medications. All of these have medications that contain fluoride in them, or fluorine as a chemical compound. And so, for example, flurazepam or Dalmine, when I was a pharmacist dispensing medications, I would occasionally see flurazepam. I would see like lorazepam or alprazolam more often, but occasionally I'll see, this one's an older one, Dalmine, but that one has fluoride in it. Halazepam and hydroflumethiazide. So these ones would have, and so I would, if you're on these medications, consider switching to another one in the family. And also, if you have elevated thyroid antibodies, that would be one factor why you might feel anxious. So kind of looking at your antibodies and doing interventions to bring those antibodies down, you can lower your dosage of the anxiety medications. And acids, so this is a problem. So people who are on PPIs or acid suppressing medications, that actually contributes to their thyroid condition. Mm-hmm. Because what it does is it lowers your stomach acid, and stomach acid is needed to digest things. So digesting proteins and absorbing nutrients like B12. So one thing is trying to get you off of the antacids, because then that will improve your thyroid in general. But the other case would be because it has fluoride in it. So two medications, Prevacid or lansoprazole and Propulsid, which is cisapride, those also have fluoride in them. And then UTIs, so women, if they have irregular vaginal bacteria, then or like a candida, then they'd be prone to UTIs. And so Levaquin and Cipro are two commonly prescribed medications for UTIs, and they also have fluoride in them. So then there are other medications that can be used for UTIs. So asking your doctor for those instead if you have a thyroid problem. And then cholesterol medications. So some common ones are Lipitor, Zetia, Lescol, and Baycol. And so those would also have fluoride in them as well. So, and again, cholesterol is something that can be addressed through diet, and our bodies need cholesterol. And actually, it's the raw material for many of the hormones that our bodies make. Estrogen, progesterone, testosterone, DHEA, all of those come from like cholesterol. Someone who's on cholesterol lowering medications is actually impairing the body's ability to make hormones effectively. And so I would suggest making dietary changes and also kind of evaluating your cholesterol. That's kind of another topic, but the way it's addressed conventionally is not really the right way either. So people put a conventional medicine puts a big emphasis on total cholesterol, but really triglycerides are what you should be looking at. And so, so kind of rethinking how we manage and evaluate cholesterol treatment.
Yeah, and
But
for
that's
me,
another tangent.
that's a huge topic. I mean, me for with the UTIs, I had so many of them, years and years ago that I became allergic to all these different medications. And
Mm,
for me, it was like that underlying gut infection, food sensitivity. It's kind of like, well, why is this? Why are you having any, anxiety, acid reflux, and cholesterol issues to begin with? To kind of to dig deeper. And and then as you say, these medications, they have fluoride, which then worsens the thyroid. So it's like this chicken and the egg thing. You run around in a circle. So.
exactly. Yep.
Mhm. Okay. And then, so a lot of people that come to us have been on long-term birth control, like literally just talked to someone the other day, 15 years she's been on it. Yeah. I talked to someone 20 years on it. So how does that impact the thyroid?
Yeah. Well, and it's interesting you say that because I literally went to breakfast with a group of girlfriends and then we got on the topic of birth control and I was like shocked because I was on birth control for maybe like a month and I was like, okay, no, this is not working for me. And these girls, they were talking about, or ladies, oh, I've been on birth control since I was 16 and like they're in their 30s. And then, I have an IUD and I was like blown away by how many years they've been on birth control.
Mm-hmm.
And birth control is a big contributing factor to autoimmune conditions. So, and some people theorize that it's one of the main reasons autoimmune conditions are more common in women than men because of so many of them being on birth control for so long. And what BC does is it changes the flora, the bacteria in your gut, and allows for conditions where yeast can overgrow and for pathogens to thrive. So that it makes you more susceptible to gut infections, which we know is a big window of opportunity for developing autoimmune conditions.
Mm-hmm.
It causes nutrient deficiencies, so it depletes selenium, it depletes zinc, and depletes tyrosine. And all of these are needed by your body to make thyroid hormone and to make active T3. And also other nutrients such as folic acid and B12 and B6, those are also depleted. So then it puts you at risk for anemia. If you're pregnant, it can put you at risk for birth defects in the baby, depression, and other conditions. And then lastly, it affects your thyroid binding globulin. So basically, thyroid binding globulin it binds thyroid hormone, and birth control elevates your estrogen. So it increases the activity of thyroid binding globulin. And so it's because your thyroid hormone's bound, there's less hormone available in the blood to be used, and then you are going to be more symptomatic and have signs or symptoms of hypothyroidism. And then on top of all that, most birth control has lactose as a filler. So, and we know dairy can be a problem for people who have Hashimoto's and autoimmune conditions. So then that it contributes to that as well. So there's a lot of, yes.
Lactose. Yeah. Obviously that's a top allergen. I think saw something like over 75% of people can be intolerant to dairy. And sometimes we think it is the lactose and a lot of times it's the casein, but yeah, so there's a lactose filler in there.
Lactose is a common filler in many medications.
Yeah. So is gluten.
Yeah, exactly. Yes. Yeah.
So, yeah. And then a lot of the people that we work with, they have gut infections. So like parasites, worms, bacterial infections, fungal infections. And now, so I was just reading that. So gut infections such as Blastocystis hominis can be associated with Hashimoto's. What's your take on gut infections?
Yeah. So gut's kind of my happy place. Like I really, I really like gut infections. There's Hippocrates, father of modern medicines, thousands of years ago said all disease begins in the gut. And it's so true today. And when we dig deeper and in people who they do the foundational things of liver detox and adrenals and healing their gut and they're still not better, oftentimes there's an infection going on. And as you mentioned, it could be things like bacterial overgrowth in the small intestine, so the SIBO. It could be candida. It could be blasto, and blasto is a parasite, and it's actually associated with Hashimoto's. And so for some people, it is a big trigger. So by eliminating the blasto, then they feel better. So let's see, I think it was I can't remember the statistic, 17% of people who have Hashimoto's has blastocystis hominis. So that's something you can test for. And if you find it, then it's important to work with your practitioner to eliminate it. So there's drug options and there's herbal and alternative options, but both of them, so kind of have possible side effects. And so it's very important that you work with someone very closely to monitor some of the die-off symptoms and negative effects as you're getting rid of this parasite in your body. So that's just, you need to work very closely with a practitioner when you find blasto or if you suspect blasto.
Yeah, we find this, well, not a lot, but definitely enough that when someone comes in with unexplained infertility or diminished ovarian reserve, and it's like, oh, we're finding parasites, there's a reason why the body's like, oh, wait, I want to survive. I don't want to procreate at this stage.
Exactly. Yes. Yes. And people have theorized that Hashimoto's was a protective gene, right? So in the olden days in Europe, when there was the potato famine and, people needed to survive. So this gene allowed people's metabolism to slow down and not procreate so they could live longer. And then when the famine was no longer, they would be able to procreate and then pass on this survival gene. So some people think that it was a protective mechanism, which served us back then, but now in today's like high stress, high toxin world is presenting itself as more problematic in, causing, autoimmune conditions and then also infertility and all of that. So
mm-hmm. Yeah, we use the GI map, so it looks at the DNA of the stool to look for parasites, worms, fungal infections, bacterial infections. And so we will recommend a herbal protocol based on testing, so supplements. Mm-hmm. Now, so what's your take on going, so this is like a low and slow approach. It maintains your beneficial bacteria. It does take longer. Some people still will go and do the conventional medical route. So what's your take on those two approaches?
Yeah, so as a conventionally trained pharmacist turned functional medicine practitioner, we always kind of look at what are the patient's goals and then help them reach their goals. And so some people lean more towards the alternative side. Some people lean towards I'm feeling crappy and I just want to feel good as soon as possible. So give me whatever works best and fastest. So keeping the patient's preferences in mind, that's kind of how it guides our decisions. Mm-hmm. As a pharmacist, I can't prescribe medication. So if they wanted to go the drug route, I would have to refer them out to someone who can prescribe that medication. So there's pros and cons to both. Both are effective. And so it's just, how do you want to approach it? Do you want to get rid of it fast, but have potentially more side effects? Or do you want to take care of it slower, take longer, but it'll be low and slow, but it's gentler. So it just depends on the person's preference.
Mm-hmm. And a lot of times it is just to please do something about it.
Yeah. Yes, exactly.
You have people that there's maybe not necessarily with a parasite, people typically do something about that, but even some of the bacterial infections, not necessarily doing anything about it, which I think streptococcus is linked to anxiety. And if there's something going on in there, to be able to, either you decide to go the conventional route or the functional route, but do something.
Exactly. Yeah, it has to be addressed because if it's not addressed, your symptoms will continue. And so if it's there and you found it, you have to address it.
Mm-hmm. And so what's your take with Epstein Barr virus and Hashimoto's?
Yeah, so it's a trigger for Hashimoto's. And so many people have reported, they get Epstein Barr infection and then they didn't feel well after that. From then on, they identify that is the turning point of their condition, And what happens is because it mounts an immune response, and so your body utilizes resources to attack the virus. And sometimes what happens is it kind of depletes all your resources, but it doesn't get rid of the virus. So then the virus is still kind of living latent in your body. And now you've depleted your different nutrients, and now you're more vulnerable to developing an autoimmune condition because you're stressed out, you're depleted, and you're still running at 100 miles an hour. So it's definitely a trigger for some people, and it can be reactivated. And even in some people, you can test to see if there's a reactivation, and you can't find it on the test, but it's still causing a problem symptomatically. So if that's the case, then they need to pursue kind of an antiviral protocol. And then again, there's drug options, and then there's also some herbal alternative options available as well. And then, yeah, it just depends on the person's preference. But typically, these protocols will take anywhere from 2 to 3 months, sometimes 6 months to get rid of the Epstein Barr.
Yeah, and that's the GI map test for that. But also you can get that tested, but with your doctor as well.
Yes, exactly. Yeah, there's a blood test they can do to test for that. But yeah, I think GI map can be, in my opinion, a little bit more, what do you call it, sensitive? Like it can pick it up better.
And so the Epstein Barr, we sort of think of mono, but also it can be, this is probably a whole other topic, but a whole other podcast, but it can also be passed through from your mother too, can it?
Yeah, so I'm not super like literate in Epstein Barr. I think that might be true. One of the functional medicine practitioners just published a book very recently at the Epstein Barr virus solution. I think it is. So it's brand new. You can get it on Amazon, and I think that that would be a great resource for your ladies or people to look into if they've been exposed to mono and Epstein Barr and they want to know how to eradicate it and if it's contributing. But I can't say to answer your question. Like I don't know personally.
Okay.
Yeah.
Cool. So the Epstein Barr solution. Okay, awesome. And so with that, actually, what are some websites or books that are your go-to or that you typically recommend? Obviously yours, which we'll talk about at the end, but anything that you recommend?
Yes. Well, I'm not very prolific in the like blogging. I'm more of a podcaster and I'm trying to get better at blogging. But so I really love the Thyroid Pharmacist. I'm not sure if we talked about it on the show, but we talked offline about how I was mentored by her. So pharmacists are really thorough in their research, and we're really good at taking sciencey things and saying it in a way that people can understand, so making it easy for normal people to comprehend. And so like I really like the way she writes, and it's very well researched but also easy to understand. And she has got tons of articles, so I think that's a great resource. If you like podcasts, like Food as Medicine with Dr. Ann is a great resource. And yeah, so Epstein Barr like book is, I think, great. Hashimoto's Protocol is a good book. Let's see. Yeah, I mean, I guess for me, like at this point, I don't really follow many people. Like I'm trying to decrease the number of emails in my inbox. And so, but the people who do come into my inbox are Isabella Wentz, the Hashimoto Thyroid Pharmacist. And then I like Magdalena. She's Hormones Balance. And I just like it because she's got great recipes and like they're always beautifully photographed. And so like it gives me inspiration for things, for how like, if I need different recipes and meals and things. And Amy Myers, I really like her. Yeah. Those are like the main people that I still read, and then everyone else I've kind of disengaged from.
Exactly. I know it's like inbox overwhelm. Yeah. And so what about a success story you'd like to share with us? Anything that comes to mind?
Yeah. So one of my patients or clients, she was such a go-getter. Like she was so motivated to get kind of to the root of her problem. And she, like the biggest thing that she really was concerned about, and rightfully so, is, when she first came to me, she had a rash on her chin. And so we made some dietary changes. I asked her to remove dairy, gluten, and soy and eggs from her diet. And within 2 weeks, she emailed me and she's like, "Oh my goodness, the rash is dissipating." And so that was really exciting. And then over the course of 3 or 4 months, we continued to work together, and we unpacked like her SIBO, and like that was kind of one of the main reasons she was bloated all the time and gassy. And yeah, so she was able to really recover from all of her symptoms and kind of be functioning again in remission after working with me for, I think it was like 4 months. Maybe, no, 6 months, because I started with her in February and we finished in August. So she did great, but she like followed everything and she took action, which is really the important thing, is like taking action on the recommendations, because we can guide you on what to do, but you are the one doing the work. Like if you don't make those changes, like in your diet and in your lifestyle, you're not going to heal, and like we can't do it for you. So she was one of the ones I just kind of am very happy about.
Absolutely. Yeah. It is a level of commitment where you're like, okay, wait a minute. I'm going to look at my diet. I'm going to make these changes to my lifestyle and just say I'm good. And then for people trying to get pregnant, to really hold the intention as to why. And everyone that comes to us they're super impatient, right? So to know that wherever you are, and I get that because I'm impatient as well, something I'm working on, but wherever you are is to know it's taken years for your body to kind of get there. So it doesn't just happen overnight. That's why we have a 6-month program, and it could be even longer. So like you said, working with someone for 4 to 6 months, and then they start noticing all these positive improvements. But it is a journey, and to be patient with yourself.
Yeah. And so with someone who has like a lot of gut infections and high adrenal dysfunction, like stage 2, stage 3 adrenal dysfunction, sometimes that can take them not 6 months, 1 year, 2 years even to really get a handle on. So just be gentle with yourself and know that you're taking action and your body is healing, but you can't rush it sometimes. And like your body needs what it needs. And sometimes it really needs for you to slow down and calm down and you take care of yourself. And so, and be patient with the process, but you will be rewarded with, feeling great and now being able to, live your best life and have the baby of your dreams and really just be that person in the world and make the impact that you want to have. But just like be gentle and know like it's a journey, and trust the process and trust the people that you've enlisted to help you along the way, and things will happen.
Love it. So now you have a free program for the listeners. So first of all, actually, you can check out Dr. Ann's site at drdranh.com, and you have a free program that's coming up. Or is it now, I think.
So I always say Ann, like A and H as in healthy. So it's DRANH. And so, I have a program that I started. It's in its beta phase. So brand new, launching it. And so for the beta phase, like you'll get access to me, and it's live and more personal attention than like ever. So, but it's a group program. So it's called Hoshi Self Healer, and it's a 12-week program. But so the first 6 weeks are free, and we go through the liver and the adrenals. And it's very important that we address those things in that order, because oftentimes people want to address the gut first, because it's like, oh, all disease begins in the gut. Let's start with the gut, But if you don't address the liver first, then your liver's backlogged. So any new supplements you're taking, you're not going to tolerate as well. And the protocols that you're doing, they aren't going to be as effective because your liver's not functioning optimally. And it's just like you kind of tune up your car every couple months, you kind of tune up your liver. So it's important that we address that first. So that's what we do in the program. So you can join it for free. And then, so for 6 weeks. And then after that, we address the gut. You can upgrade to do the gut protocols with me. And, I walk you through my protocols, and I give you recipes. You have Q&A every week. You can get program supplements at a discount. You can self-order labs for yourself if your doctor's not willing to order labs. So, and there's the group support and teaching as well. So I think it's a great resource.
Definitely check out your website, dranh.com. And thanks so much, Ann, for coming on. This was so awesome and just a fountain of information. And I thank you very much.
Yeah, I really enjoyed getting nerdy with you.
Hey there, Sarah Clark here. So are you struggling to have your baby? First of all, please know that my heart goes out to you. I support couples worldwide who are struggling with infertility to conceive and have healthy babies. Women like Rita, who gave birth to her beautiful daughter after following my fertility coaching system. Or Danielle, who after 2 failed IUIs was able to get pregnant after a supercharger fertility discovery call with me. So here's how you get my help for free. So I offer a free supercharger fertility discovery call. And on that call, I'll create a plan with you that is going to help you fast track your success. So this call is not for everyone. And I'm really picky about who I get to speak with. And I have a strict but totally reasonable criteria that needs to be met in order for us to move forward. So here's who I can help. So first of all, you need to be able to explore your infertility diagnosis in a new light. So this offers for people who are open-minded, they're coachable, and if you can do that and want to double or triple your chances at the fertility clinic or get pregnant, awesome. So let's get on the phone and chat. Also, you must be an action taker. So someone who's committed to seeing results, you're able to follow directions. Don't worry, I'm not going to ask you to do anything bizarre. But if you're one of those people who like to consume a ton of information, but don't like to spend time implementing and seeing results, then the call's not really for you. So I only want to spend time with people who are genuinely committed to their own success. So just click on the link in the show notes and apply, or go to fabfertile.com and click on the free consult. So it's a really short application that just tells you about your health, how long you've been trying to conceive, and how soon you'd like to be pregnant. So seriously, this is going to be the best time you've ever spent on your fertility. Looking forward to chatting. Talk soon. Thank you for listening to Get Pregnant Naturally. Seriously, it means the world to me that you're here. Make sure you hit the subscribe button so you can be notified of upcoming episodes. I'm excited to offer you a special gift. If you're a U.S. resident, text FERTIL to 345-345. You'll be prompted to enter your email address and you'll receive our Fertility Yoga download. In this 20-minute intro video, we focus on a calming and peaceful practice to connect back to your heart. These simple fertility yoga poses can help quiet negative thoughts and make you feel more in control. Download it now and get started today. So for U.S. residents, text FERTILE, F-E-R-T-I-L-E, to 345-345. For non-U.S. residents, go to www.yogafreebie.com to access your special gift. That's www.yogafreebie.com to access the free fertility yoga download. And I love this quote by Dr. Mark Hyman, Medical Director of the Cleveland Clinic Center for Functional Medicine and Chairman of the Institute for Functional Medicine. Functional medicine is medicine by cause, not by symptom. Functional medicine practitioners don't in fact treat disease. We treat your body's ecosystem. We get rid of the bad stuff, put in the good stuff, and because your body is an intelligent system, it does the rest. Thanks for listening. Until next time.